Thanks, Mr. Chairman.
Thanks, Senator Blumenthal. Senator Cornyn?
Thank you, Mr. Chairman. Thank you to the witnesses for being here today. As I've been listening to the testimony, it's just another reminder of how frustrating and maddening and frankly infuriating it is that Congress has been unable to deal with this in a more timely and a more targeted manner. But I'm also reminded of the fact that technology does not move at the speed of legislation. And it seems like the people who profit from this technology, these apps, are very adaptable to whatever obstacle, whatever penalty that Congress might impose. But Mr. Peruzzo, I think it was you that made a comment. It really jumped out at me. You said we ought to make use of children's data illegal. Did you say that?
I'm sorry, Senator. No, I didn't.
Excuse me, Doctor, you said that. Okay. And in thinking about the model, the business model of these apps, they're primarily designed to hoover up data, including personal data, and then use that data then to apply algorithms to it to provide additional enticement or encouragement for people to continue using that app. Is that correct, Doctor?
Yes, it is.
And so if we were able to figure out how to make use of a minor's data illegal and had appropriate penalties, that would attack the business model and go after the people who profit from this technology, correct?
I believe so.
Well, maybe there's something fairly straightforward we could do in that area because, as I said, obviously legislation moves very slowly, and these the people who profit and benefit from this sort of technology are very adaptable and move at much different speed than we do. Ms. Bride, we all grieve with you over your loss of your son, but in listening to your testimony, it seems to me that you did just about everything that a parent might do to protect your child, but yet you weren't able to completely protect him from the cyberbullying. Can you talk a little bit more about the role of parents in protecting their children? And are there other things that parents should do that you weren't able to do or didn't occur to you at the time?
Thank you for the question, Senator. Yes, parents absolutely have a role, like we took, in talking to their kids about online safety and managing screen time. But we're at a situation right now where, if I can give you all a visual, it is like a fire hose of harmful content being sprayed at our kids every day, and it's constantly changing. And I wish I could testify and say, all you have to do as a parent is these 5 things, and you can hand the phone over and your kid will be safe. But that would be irresponsible of me. And this is why we need to go back to the source. The source of the harm is the social media companies and their dangerous and addictive products that are designed to keep our kids online as much as possible. And in the example of anonymous apps, what better way to keep kids online but let them in a public forum say whatever they want to each other without their names attached.
Yeah. Dr. Prinstein, you make the point about needing more investment in mental health studies and resources. You're probably aware of this, but I'll just remind you and remind all of us that in the Bipartisan Safer Communities Act that Congress passed last summer, we made the single largest investment in community-based mental health care in American history, together with additional resources for schools. In that context, it in the wake of the shooting at Uvalde and the obvious failure of the mental health safety net such as it exists to deal with young men, in this case, who fit a dangerous profile of self-harm or harm to others. But could you speak briefly to the workforce challenges? If we make these huge investments in mental health care, we need people to be able to provide that care, trained professionals and other associated professionals. And where are we today in terms of providing that sort of a trained workforce to deal with the need?
Thank you so much for the investments that you all have made so far. Unfortunately, it's just a start. The federal government currently funds the training of physicians at a number 750 times more than the amount that's invested in mental health professionals. The CDC report that you just saw and a number of senators have discussed is likely a direct product of that disparity. It's critical that we are funding psychologists and other mental health providers with the same commitment and at the same level that we do our physician workforce and think about physical health. Also, thank you for noting the importance of the slowness by which our progress is in the social media area as compared to the rapid way in which social media changes. This is also why a commitment to social media, research on the effects of social media on mental health is so urgent now, because for us to do a study to learn how social media will affect kids over many years, it will take many years to do that study. So we must start immediately investing much more in that research. Thank you.
Thanks, Senator Cornyn. I'd also like to recognize the presence of former House Democratic leader Dick Gephardt and former Lieutenant